What's going on, guys? Spencer here with HM Massage. Today we're doing a pec and shoulder massage technique video. I just wanted to talk quickly as we warm up with the massage. This is a very important area to work, but a huge thing with especially being a guy and working this area is keeping communication open. Make sure that the client feels secure at all times. The pecs and shoulders are really important to work. They do cause a lot of shoulder and back pain. So you have to hit these spots, and the overall rapport and trust you have with the client is what's going to lead to the best possible session. But you can't be afraid to work this area because it is important. So just wanted to say that. Now let's get into it. So the pecs on deck. Just like every other muscle group, we're going to start by warming it up. We're going to take our time working into these muscles because they can be very sore. And as the muscles let go and the body lets us in, then we're going to start working deeper towards the attachments and finding all the adhesions and muscle knots. So I'm always warming up with an open palm using more broad pressure. And this is a good chance to test out the client's range of motion, see how far their shoulders can move on their own before the work is done, and get a feel for not only how tight the belly of the muscle is, but also the attachment points. You'll see my client laugh here. Just know that this area can be ticklish for some people, so make sure you're going in slow and with a broad pressure, and also a firm pressure so it doesn't tickle. This isn't the best angle here, but that is going to change in just a minute. But just starting by grabbing the bulk of the muscle of pec major and doing some petrissage while also some pinning and stretching, and then moving to the biceps. Now, of course, there are two major pec muscles to hit. You have pec major, but you also have pec minor underneath, which can cut off nerves when it's very tight, sending a lot of pain down the arm. So you have to be sure to hit both. So I'll talk how to hit that deeper muscle in just a little bit. But overall, hitting the anterior deltoids, the biceps, and the big pec muscles is going to feel really good. That's because most people have very tight pecs and shoulders from the rounded society that we live in with driving and texting. And this isn't an area that gets released a lot, both throughout your daily life or in a lot of massages. So when people have this newfound blood flow, it makes you feel completely renewed, completely alive again. And especially when the client gets off and they have this new shoulder range of motion that they haven't had in months or maybe even years. So it's a very vital area to work, and the client is going to love the way it feels both during and after. Well, maybe not always during, because this area can be very tender, so always work within your client's comfort zone. And you'll notice that I like to do a lot of work at the anterior deltoid attachments here. So not only working the pecs, but the deltoids themselves, as well as the arm, the biceps. But right now I'm just doing a light pin and stretch, pinning down at the anterior deltoid, and then externally rotating and extending her arm away. This is all to get things moving, and I do often get asked, but this is an area that you don't need a ton of lotion or oil. I think I'm using a little bit just so I don't pull the skin, but you don't need a ton of lubricant here because it is a lot of specific work, especially with pinning and stretching around the attachment points. So a little bit will go a long way here, but this area right here becomes so shortened and so rolled in on itself because we're driving, texting, watching TV. Our arms are always in front of us. So it becomes very important to warm up and open up the thoracic area on people. Thoracic extension is a great way to realign your body and just be generally healthier. So as mentioned, I'm using the flat side of my palm and my fingers in order to go both along the belly of the muscle, but focusing on the two attachments, one at the sternum, the other one at the clavicle or your collarbone. Make sure you hit the attachments of both of those, as well as up into the anterior deltoid and glenohumeral joint. But I generally keep the pressure more broad, doing long, slow strokes, solid, firm holds, or small circles of vibration. I generally am not too specific or pokey with the pressure. Here, I'm taking my fingertips and spreading out away from the anterior delt, and then using my pisiform bone, the bone in your pinky side of your hand, to do some vibrational circles to help mobilize the joint itself and loosen up not only the muscle, but the tendons, the ligaments, the fascia, any of the connective tissues going on in there. Notice that I am supporting the underside of her shoulder with my right hand when I do this. It's always better in a massage for the client to feel like their joints are completely held and controlled. Then I'm going into more of a specific hold. This is usually the only area that I'll get really specific with, and that's all along where the biceps, pecs, and anterior deltoid meet, along with some other muscles. But I specifically hold down those fibers, externally rotate the hand, of course within the client's range of motion. This client has really good range of motion. And you'll see some of those pec and deltoid fibers kind of popping under my fingers. That's how you can tell they're pretty tight, so definitely needed the release. And nice long traction, because traction is everybody's friend. It always feels good to be pulled apart, along with some very long external rotation. I told you this client's very flexible. A lot of people cannot do that, but for the client, it was no issue at all. Smooth transition over to the other side and répétez s'il vous plaît. You have two sides of the body, so repeat all the same techniques to the other side. It's not quite as boring as just doing the same thing though. Take this moment as you're working another side of the body to assess how it feels compared to the side that you just worked. Is it tighter? Is it more shortened? Does it have better range of motion? Worse range of motion? Are their muscles bigger, stronger on that side? All of these questions can lead you to assessing their full body health and maybe some things in their daily life that you can then suggest to change or fix. Massage therapy isn't just about rubbing the muscles, it's a lot more about the holistic health of the musculoskeletal system, and a big way that we can help fix that is by giving them some advice on daily activities they can change or how they're doing those activities in order to better enhance their wellness. But I basically repeat the same techniques on her right side. I think this side I do a little bit better of a job of keeping the strokes a bit more broad and a bit more Swedish in a sense. So of course I always start with the range of motion assessment, just testing out this shoulder, comparing it to the left. And of course, this is more of the superficial muscles of the deltoid, the pecs, the biceps. Remember, you do have these deep rotator cuff muscles under there, as well as simply the bursa of the joint. But all of this work will lead to a healthier shoulder joint. So it's really important to do and get done. But I think I do a better job at applying a very broad pressure, making sure to work right under the clavicle, because not only do you have the pecs, but you also have a subclavius muscle. And then working the entirety of the muscle. It becomes very important because tension lies in all aspects of muscle fibers, not just one side. But there is a really good example of pressing in for a deep Swedish stroke, some deeper friction, and not being afraid to work this area, of course having that communication and that rapport built. Slide all the way up into the anterior deltoid and go into the petrissage, the lifting and squeezing, and the petrissage pin and stretch. Once again, this client has great range of motion, very flexible, but most people probably can't go back all the way, especially if they've had a surgery or rotator cuff injuries. So make sure to know what your client's limitations are before we work this area. And the one area I do get more specific and pokey, right there, anterior deltoid fibers. Separating out all the tension and all the space, bringing in that blood flow and allowing the healing to happen. I'll then place the client's hands on their belly. I kind of like this area because it gets it out of our way and it's a comfortable area for most clients to lay. And then using both hands, I'll traction apart the front of the shoulder, support that shoulder with my underhand, the offhand, so that once again, their joint feels completely encompassed and completely in my control. It doesn't feel like it's flailing around, always feels supported. And getting into more specific movements, vibrational strokes, petrissage, deep friction. Lastly, traction is everybody's friend, so do some real quick traction outward, upward, and take it into the external rotation. Thank you so much for watching, guys. Hopefully you enjoyed the video, you learned some techniques from it, or you just got relaxed and enjoyed watching. Give it a thumbs up if you liked the video, and subscribe to the channel for new content every single week. Turn on the notifications to get alerts when I do upload, and I will see you guys on the next video. I hope you guys have a great rest of your day.